Bronchiectasis is defined as dilatation of the airways that's irreversible. Patients with bronchiectasis generally have chronic cough, often with sputum production, and will often have exacerbations. However, it's important to know that it's a very heterogeneous condition. There's a large variety of underlying causes and a huge spread in how symptomatic patients are.
A lot of patients with bronchiectasis are misdiagnosed as having some other kind of pulmonary disease like COPD or asthma. And really the only way that I know to differentiate that is with a chest CT scan. And that is what we order. Mostly a high resolution chest CT for the first scan, but we would often use lower dose radiation for follow-up scans. But how about you?
No, that's exactly right. And I think it's important to really look for the radiologic diagnosis of bronchiectasis, right? So we may have a patient that presents with cough, abnormal pulmonary function testing, right? But if we're suspecting bronchiectasis, we should get that chest imaging, right? Either a chest x-ray, but most often a CAT scan of the chest, because that's really how we're gonna see the dilated airways and really diagnose bronchiectasis.
Yeah, and it's important that we look for certain features, right? Looking at an airway to artery diameter to define that enlarged airway, lack of tapering, the visibility of the airways in the periphery. I mean, there's some very specific things that our radiologists will be looking for that should help us make that diagnosis of bronchiectasis.
Yeah, and I think it's important for us to review images ourselves too, right? So not just always rely on the report, because it may or may not mention bronchiectasis, but when you review it independently, you may pick up bronchiectasis, even mild cases, right, that may not have been mentioned.
Yeah, we all see this. We see the reports that don't mention bronchiectasis, but when we see the scan, we see the bronchiectasis.